So I have to wash my hands in preparation to administer medication. So my hands are all washed. Then I have to unlock the medication area. I have to get my medication book and my count book for Tanisha Johnson's, her 8 p.m. dose of the phenobarbital 32.4 milligrams. It's on page 4. So I have this. I'm just going to set it over to the side so I can document that later. Now I have to go to the med book and I have to look at for Tanisha Johnson. So Tanisha Johnson says here in the name, and now I have to unlock the medication and check the medication pharmacy label. I have to check it to the healthcare provider order. So I'm looking for Tanisha Johnson. Tanisha Johnson, the phenobarbital 32.4 milligrams IC luminol, so luminol, and this says by mouth daily in the evening. So this medication pharmacy label says once daily in the evening by mouth, and this healthcare provider order says by mouth daily in the evening. Now I have to check the pharmacy label to the med sheet for Tanisha Johnson. Tanisha Johnson, the looking for the phenobarbital 32.4 milligrams of the IC luminol. Take 2 tabs. Once daily in the evening by mouth. This says amount 2 tabs daily in the evening by mouth. Now I have to pop open my medication, and I need 2, 1, 2. So there's 2 in there, and I have to set that aside. And now I have to check the pharmacy label again to the medication sheet. So for Tanisha Johnson, her phenobarbital at 32.4 milligrams. Amount, take 2 tablets. Route by mouth daily in the evening, which is the frequency. And now I have to have my medication and my water, and I have to give them to Tanisha. And now I have to watch Tanisha take the medication, swallow it. I have to observe, and then I'm going to look again the pharmacy label to the medication. So the phenobarbital IC luminol 32.4 milligrams. Take 2 tabs. I gave her the 2 tabs. Once daily in the evening by mouth. This all says take 2 tabs once daily in the evening by mouth. And now I have to put the medication over to the side. I have to sign this with my initials stating that I gave it to her. If this is my first time giving medication in the month, I also have to sign the bottom of the med sheet with my initials. Now I have to close the medication book, put that away, and now I have to write in the count book. So it is the 3rd, 6th year, 8 p.m. and then the root was mouth. The amount on hand was 30, and then I gave her 2, which would leave me 28. And now I have to sign the count book stating that I did it. And now I have to close up the count book and put that back. Now I have to lock up the medication, lock up the medication. And now I have to wash my hands again after distributing the medication. So this is my my count book for Tanisha Johnson, and then I have my medication book for Tanisha Johnson, her phenobarbital at 8 p.m., the 32.4 milligrams, 2 tablets, once daily in the evening by mouth, and this is the medication.